I'm Astrid Janssens. I'm a professor of patient and public involvement here at the UMC Utrecht. I'm also affiliated with the University of Southern Denmark and the University Hospital there in Odense.
Hi, I'm Luca. I'm a PhD student within the UMC Utrecht and I'm doing my PhD on the ILLUMINATE project. My main focus are the technical developments for metabolic MRI. So I do the MRI scans, I analyze the data and try to improve. And I am also involved in the STIC.
My name is Leonie Visser. I'm an associate professor at the UMC Utrecht and my expertise is in medical communication and patient engagement. Within ILLUMINATE, my role is to coordinate the stakeholder involvement community. So I try to connect the patients and healthcare providers within our stakeholder involvement community with the researchers and other consortium members.
The STIC is the stakeholder involvement community. We have chosen for this particular model to engage patients and members of the public, but also different stakeholders like healthcare professionals in the ILLUMINATE project to make sure that the decisions that we make on how we run the project are both supported and informed by how patients and stakeholders like healthcare professionals want this to run.
And I think what we set out to do is really make sure that everything that we ask our patients and healthcare providers within the stakeholder involvement community to do, that also will have an actual impact, because they will provide their time voluntarily often, and you have to make sure that that actually contributes to something.
For me as a researcher, the value of collaborating in the STIC is that I get to hear the perspective of the patients and I can implement that in how I improve the metabolic MRI. Another added value of me collaborating in the STIC is that I can be kind of a bridge between the patients and the technical side, so I can inform them properly on what metabolic MRI is and help them understand it, so they can give good suggestions on the project as well.
There are different types of knowledge. Then you have got knowledge that comes with being a patient, living with a certain condition. We think that it's important to include all of these types of knowledge to make sure that we conduct research that is ethical and that is also meaningful for our future patients.
Yeah, for me as a researcher, I think it's highly motivating to work with the people who are the end users of the knowledge or the projects that you develop. And I also think it's really fun.
When we think or work on developing treatments or improve healthcare for certain parts of or certain members of the population, I think it's only normal that we work and collaborate and engage their knowledge, their experiences in how we run projects or conduct research.
I think there's always viewpoints that I didn't think of before that come to the table and that also enrich my view as a researcher. So I would definitely advise all researchers to involve patients in their work.